Well, welcome everyone. Thank you for coming to our webinar on healthy aging and hunger in our aging adult population. The North Carolina Alliance for Health is pleased to be hosting this with our partners at the North Carolina Coalition on Aging. And I'm going to hand this over to our moderator, Heather Burkhart.
Thanks, Marianne. I'm Heather Burkhart. I'm with the North Carolina Coalition on Aging, and we are just really grateful to be here and doing this in partnership with a North Carolina Alliance for Health, who is doing so much in the food and nutrition world, and excited that we're focusing today in bringing in experts around seniors, hunger, nutrition, food insecurity. So I see that there's really some strong interest in this topic, and we're really excited about that. And to bring together this amazing group of experts on these issues. We know the attendees today are representing a variety of organizations. Some of you may come from sort of a food background, some might be from aging services or the medical community. So I'm glad that we're going to be here today and be able to generate some discussion about an issue that's not talked about a whole lot, create some awareness on the challenges facing older adults in our communities, and discuss solutions around policies and programs and research that we need to do to help elevate older adults who are suffering from food insecurity and malnutrition. So today I am joined by these wonderful experts here. First, I'll go ahead and introduce them. Neil Curran is here. He is the Director of Food Programs at Reinvestment Partners. And if you don't know about Reinvestment Partners, they're a nonprofit organization with a mission to foster healthy and just communities. And they do that by looking at issues around poverty, including a focus on food, housing, community development, health, and financial services. And Neil has worked in these aspects of food production and distribution since 2008. We also have with us Linda Miller from the Centralina Area Agency on Aging. And Linda has more than 30 years of experience in the field of aging. Centralina serves a 9-county region surrounded by Mecklenburg County, and area agencies on aging support a wide variety of health food access programs, including things like Meals on Wheels, home delivered meals, congregate nutrition sites, and the Senior Farmers Market program. Linda is also serving on the board of directors for the National Association for Nutrition and Food Services. Also, later today, perhaps, joining us will be Amanda Holliday. And if Amanda pops in, she is the associate professor in the nutrition program at UNC Chapel Hill Gillian School of Public Health. She is a chair of the North Carolina Board of Dietetics and Nutrition. She is also a member of the North Carolina Institute of Medicine on Healthy Task Force for Healthy Aging, and focuses her research on older adults and nutrition. So as we get started here today, I'm going to pose some questions to our panelists, but I'm really inviting Neil and Linda to kind of interact and kind of feed off each other and have some discussion. You know, it's Friday, people are just having their coffee and getting their day started. So let's just try to have some rich discussion. We also will ask for questions in the chat as we move forward. So if you're okay with it, we'll just dive in. And the first way I want to start with this, and part of it's because I kind of come from a data background and I love numbers and good figures. But as you have done this work, both of you, from your perspective, could you just start off by throwing us out one of the facts or data points that strikes you in this work that you find especially compelling? Hey, Amanda, we're glad you're here. We're just getting started, and I've already introduced you. And so we're just going to get started. Talk about one of the data points that really strikes you and a little bit about it. Something maybe that people on the call don't know, or when you interact with other professionals that they may not be aware of. And I'll toss it to you, Neil, first.
Sounds good. Well, thanks for having us. I'm glad to be here with all of you doing, I'm sure, great work in the space. So I'm sure I'm not the most up to date on my data. So my data numbers may be out of date. But the things that always strike me in thinking about hunger, especially among seniors, is how little SNAP benefits people get. And I don't think that's news to anybody, but I think it's striking, right? And this is where my numbers are probably out of date. It would last, as of like 2020, it was fewer than $20 per month that folks were getting as an individual elderly on SNAP. So I leave it to people who are more have their pulse, more of a pulse on that, to update me on that. But that's kind of how we got into this work, was recognizing that there's people who are elderly on SNAP are still struggling. And I mean, I could share more about the programs we're working on later, but and then just thinking about the sheer volume of people who are either on SNAP or food insecure, which again, my numbers are kind of based around the COVID numbers, which was at the time, it was the numbers were doubling.
Yeah.
And I know that things have changed since then, but still the fact that many people are kind of like on the edge of precariousness, that they could, their situation could change so quickly. Those numbers are always very striking to me.
Yeah, and I would say, and I'll just jump in there too, not only are the numbers lower, and COVID really did expand that benefit for so many people, but now we know with the end of the public health emergency that those are going to be declining, going back to their original numbers. And so the last I saw, there were about 20,000 older adults who are receiving SNAP benefits that will kind of go off that cliff, if you will, and go back to those original numbers. Linda.
And Heather, we had a question in the chat, and that question was, can y'all explain what SNAP is?
Yeah, I'll let Neil take that. Great question.
Sure. Yeah, SNAP is used to be called food stamps, the Supplemental Nutrition Assistance Program. The federal government partners with state governments to issue electronic benefits on cards, EBT cards, and the funds are restricted to certain items, mostly food products that are not prepared or hot foods. And yeah, it's kind of, in my opinion, and I think probably a lot of people would agree with me, it's the premier anti-hunger, anti-poverty program. I mean, it's the biggest in size of most, besides like Medicaid or health insurance programs, but it's kind of the front line of anti-hunger, but really anti-poverty, I would say. And what else to say about SNAP? I mean, it's issued through the Farm Bill. Oh, go ahead.
No, I was going to just let people know they apply through their Department of Social Services for that program if they're eligible, to determine eligibility and to get signed up. But yeah, it comes from the Farm Bill.
So I think what's interesting to think about in our how I interact with it is that every Farm Bill cycle, which is every technically 4 years, but it ends up being more closer to 5, this funding gets renewed, and it's always kind of politically contested at the high levels, because you have a lot of farmers groups and anti-hunger advocates, working together to come up with what's going to happen. And some, and every year it kind of gets used as a chip in the political game. So there's constantly back and forth about what kind of requirements will be applied to the people who are going to receive these benefits. Like, do they need to be able to have to do some kind of work requirements or not, drug testing or not? So it's kind of it's an ongoing kind of struggle back and forth politically, and it's a space that a lot of advocacy goes into.
Absolutely. I'm seeing a question in the chat about the number of seniors who qualify for SNAP. And I know that of the people who are 55 and older, only 59% of those people have signed up and are using that service. So it's a very underutilized service. And so outreach is incredibly important. It's sort of money on the table that people are eligible for, but they need to apply to get it. And so I think that's one of the barriers, is getting older adults to apply for those SNAP benefits. I'm going to toss it to Linda to see what your big data point is for this Fun Fact Friday conversation.
Well, first of all, thanks to everybody, because I agree it's a Friday morning and it's often difficult to get people here. So we appreciate everybody here. And I myself am excited to hear more from Neil and Amanda. I haven't met them before, and I'm excited to hear more about what they have to say on the topic. And before my data point, I'm going to cheat, Heather, and I'm going to mention the person in the question had asked why. And we had a grant years ago. I think over the years we've had a couple to see why, as an area agency on aging, why do we think, and do some surveying and some different things about why older adults don't go. And it's, a lot of it is just not being aware of the program, not wanting to be perceived as receiving public assistance sometimes. And then there were people that thought that, well, it's such a low amount of money, who cares? It's a lot of hassle to go through for $20 a month or $30 a month, getting the assistance they need to get the application. Now, these were a few years old, so I know some things now are different online, but a lot of seniors aren't really able to have Wi-Fi in certain rural areas, or aren't very savvy when it comes to using computers to do different things. So there's been a lot of reasons why, like the perfect storm, but it is something that we have to look at frequently to make sure that potentially they could, access this benefit. So I know that's what we saw when we've done past programs that looked at that. So I don't know if that's what Neil and Amanda hear as well. Yeah. So probably know more than I do recently. So one thing, and I also took a little liberty just talking about older adults. And one thing that blew me away years ago when I heard this statistic, and most people find hard to believe, is that 50% of all older adults in the entire United States live in 9 states in the United States, and North Carolina's one. And to me, that is just astounding, because think of the other, 40 something states, right? That is just a lot of people in our region. And I think, given that, and given some of the data Neil's already given you, and probably what Amanda's going to say when you go to percentages, that just means by just the sheer numbers that we have, we're going to have a lot of people in this situation. I think it's like 8% or more now of older adults go hungry. So since we are really in one of those high population areas, we have an issue that we need to talk about and see if we can find solutions for. So
I hadn't heard that number before, Linda. So I knew we were the 9th in terms of the older adult population in the nation, and that, our percentage of poverty for older adults is relatively high. And so, that nuance is definitely there. And, you can't deny the number of people moving to North Carolina within migration, and folks who are aging in North Carolina. So we're definitely a high growth in that population. And feel free to take any liberty with any of these questions. It's
Thank
really
you.
just to spur conversation, and I'm all about breaking rules. So welcome, Amanda. We are glad you're here. And we're glad that you kind of bring a research focus in this and kind of another lens. So what are you seeing, kind of in your world where you're looking at nutrition and malnutrition and in the research world?
Well, I think my data point was the one that was already mentioned, that only 59%, which has already been discussed, of eligible 55 plus elders are utilizing SNAP. And I think that's very unfortunate. I'm glad Linda outlined some of the reasons for that. And I think it's important for us to recognize how important SNAP is to reducing medical bills, that SNAP utilization does reduce medical bills and increased utilization of hospital services, that we know that people who are on SNAP have fewer nursing home admissions and hospitalization rates. And so I think that's a important point for us. I think it's also interesting to think about other programs out there, right? Besides SNAP, we have the home delivered meals, or what we all think of as Meals on Wheels, and the congregate meal program. And in 2020, we were serving around 24,000 congregate meals, and we were doing about 20,000 home delivered meals. And all counties are thinking about that differently based on their geography and many different variables, volunteers, et cetera. But as we think about those who might not utilize SNAP, we could think about other ways to help them have food. And those might be two other ways that we could do that.
I think that's a great point. And I don't know if people always realize that those home delivered and congregate meals have to meet 1/3 of the recommended daily allowance. And so that there are real specific criterias on the meals and how they're prepared and delivered, so that they know they have a standard of nutrition. And probably about 10 years ago, there was some surveying done that really, even though those are 1/3 of the recommended daily allowance, they actually, for most people who received those, it was more than half the meal they got during the day. So, really important program to make sure that we're targeting and identifying people in need.
I think a recent update or something to continue to think about is when there was the reauthorization of the Older Americans Act, that malnutrition screening and prevention was added. And so that's big for us to think about screening outside of the hospital, even for malnutrition. So I hope to see that also raises awareness, not only for malnutrition, but also food insecurity.
And I think that's great. And I'll just chime in. You mentioned the Older Americans Act. And so that's a federal act too that provides a lot of the funding in North Carolina for those home delivered and congregate meals. There are also state dollars that go into that program through the Home and Community Care Block Grant that are given and worked with the area agencies on aging, and then in most communities provided at the community level. There is a waiting list for those services, and both of those nutrition services have a large waiting list. And so that Home and Community Care Block Grant has upwards of 10,000 people already on the waiting list. So we know that they're highly utilized and in demand, but need to continue to advocate kind of from the policy perspective to continue to invest in those programs. And being able to look at it from the hospital readmission or hospital admission rates, I think, is a nice way to look at that. Linda,
and one thing,
chime in.
Sorry, Heather, one thing that I wanted to mention too, I'm glad Heather brought that. Amanda brought that up, but one thing really that we've learned through the pandemic, which we're still now allowed to have some flexibilities with the Older Americans Act, because we're under an emergency declaration, of course, until probably late spring, but is that we've found new and different ways that we really weren't able to utilize before to reach older adults, such as grab and go meals, which is still the same, the meal, but at least we were able to get people meals in the way was their preferred method, so that nobody was really feeling comfortable, and some people still aren't, about going to a congregate dining site. Some are open, some are not, and really pushing the boundaries of some parts of the Older Americans Act that are still very, very old, very dated, and maybe we have to look at those types of things so that we can expand these programs to reach more older adults. Congregate, grab and go, more drop off food boxes and groceries, and that's maybe one of the only good things that we saw that happened in our service delivery aspect, is that we were able to do some new flexibilities, and potentially we're going to advocate that those are things we'd like to continue to do and look at, and we feel we could reach more people those ways.
And Linda, we have a couple of questions in the chat, but before we look at those, I wanted to say that, you really pointed out where there's a lot of overlap between child feeding programs and the feeding programs for older adults, and yet those are often very siloed and separate. And is there an opportunity to learn from what is working for one and apply that to the other? Both often have limited methods of transportation. They can't independently do some things, you know? And so I think that there's a real opportunity to share in knowledge and information. But we have a couple questions. One is more of, or maybe more comments. Jennifer has mentioned that the local food council has been really working on expanding double up bucks around North Carolina, that South Carolina and Kentucky both have statewide programs. Neil, I know Reinvestment Partners has worked a lot on this issue, so that may be something you'd like to touch on. And Elena mentioned that there's been some research that led to some areas, including pet food deliveries with their Meals on Wheels, because older adults were sharing their meals with their animals. And those meals are a really important component for older Americans.
Yes, so I can jump in on the double up food bucks question comment. And say that yes, RP has been working with nutrition assistance programs since 2018. In fact, Ileana Vink, who's on the call, is a good example of a program partner who we've worked with for a long time to distribute what we call produce prescriptions. So additional food assistance dollars to folks who are food insecure. So as an example, we worked with Ileana and her team way back in the day. We got a grant from the USDA through, used to be called the Food Insecurity Nutrition Incentive Program, now the Gus Schumacher Nutrition Incentive Program. And long story short, we worked with her and also groups like Senior Pharmacist in Durham to target low-income elderly individuals who were on SNAP and provide them with $40 additional restricted to fruits and vegetables. And so, you know, that's the same funding mechanism that those double up programs have kind of got started with. It's true that the state, as far as I'm aware, North Carolina doesn't have an ongoing state program to fund that type of thing. Our Reinvestment Partners has been successful in raising, to date, we've raised $13 million through the state of North Carolina General Assembly's appropriations to fund our program model. And so that's been helpful for us to be able to broaden our reach of distributing these funds electronically to eligible individuals. Some benefits of that are just that, you know, for those who can shop and can cook for themselves, it's a really effective way of getting money out to people quickly. It allows them choice to be able to choose their own items and get them themselves. So that's the model that we're operating under. I think it would be good for the state to invest in this as a more long-term structure. I will flag that as part of the Medicaid Healthy Opportunities pilots, fruit and vegetable prescriptions are an eligible service. So I'm not sure if folks are familiar with the Healthy Opportunities pilots or HOPS, but that is what's heartening to me is that in North Carolina, like Medicaid dollars are now paying for produce prescriptions or you know, nutrition incentives on top of, and it's separate from SNAP benefits, but through Medicaid. And that's hopeful because we're optimistic that the data and evidence will support the fact that, or you know, this concept that giving people healthy food will improve their health and will be a really effective way of you know, reducing, say, hospital readmissions or instances of diabetic episodes. So that's to me, that's really good news, and that's kind of, we're just in the beginning stages of implementing that. So it's not a dedicated program just to this state funding just to this program, but it's within Medicaid, which I think is also that's hopeful.
I think that Medicaid piece, yeah, that's the innovation that I think is an exciting opportunity. And it, you know, when we think through some of these new innovations, like what you're doing with prescription drugs, like what's going on in the Medicaid world, I'm wondering if maybe Linda or Amanda could share a little bit about the Senior Farmers Market program, because I think that's another opportunity where people are engaged to have access to food in a different way.
Amanda, I'm going to let you take it. I know enough, but I'll be really frank. Unfortunately, one of the problems, and I'll let Amanda explain the program, is it's not in every county. And over the 25 years I've been with our AAA, we've only had one county ever that received that funding, and they handled it directly on their own. So I'm going to defer to you.
I can't answer much about that. I was going to chime in myself about what Ileana had to say about the dogs and tell you about a program that we had piloted, but
All right, well, Heather will help us. Heather will
I'll help
us.
you, but I want to hear about the dogs. So, and so there is a federal program, Senior Farmers Market program, that does give grant funding to states, and North Carolina is one of those states that receives vouchers for older adults to be able to go to their local farmers market and purchase produce on their own. And so, although it's really limited, I think it's another innovation that sort of allows people to purchase food in a way that they want to, fresh produce, and it also benefits kind of, you know, the farmers market. So it's a win-win in terms of supporting local communities and economics with partnership with farmers markets. So sorry to stump you there, and I'll turn it back to you, Amanda. I do think I've seen, at least in our local area in Wake County, where they partnered with the SPCA, and they have donations that they work and deliver some of those pet foods as people are delivering home delivered meals as well.
yes, and I would just say, Heather, to go before we talk about that, your point about the farmers markets, that those vouchers are distributed once a year. Is that correct? That was my understanding with the one time I've worked with Orange County on that. So that's not something that goes on all summer. I mean, those are distributed and then they're utilized, and that's which is nice, but yeah, it's well, Ileana brought up dogs. As a huge dog lover, one question that we had was, could we work with the NC State Vet School and their veterinary nutritionist, Dr. Saker, and think through feeding guidelines for dogs, think about what foods are eligible on SNAP, and then come up with recipes that would meet a third of the DRIs for older adults and be safe for animals to consume, with the intent that it wasn't to be the only diet for the dog, but that it would be a nice substitute to their diet if there wasn't enough pet food. We've seen them be accepted in several different counties, but we forget things like brown rice and black beans and sweet potatoes, cheese. All of those are things that are safe for dogs to consume. The biggest concern is temperature. A lot of times is we don't want to give dogs hot food, but we might eat it hotter. And so we came up with guidelines based off of work of a student of ours, the dog's weight, and then how much what would be the serving for the dog and what would be the serving for the human. So I think I'm glad Ileana brought that up, because, pets provide so much emotional support for so many of us, and their health is a big impact on our health. So.
And those of you that serve older adults, or anybody really, I know that Banfield has rolling grants that will help people anywhere in the state. And a lot of our providers have had some success with some of those, as well as some other small local grants or different things like that. Unfortunately, it's not anything that we can work into the cost of the meal or anything that the Older Americans Act, or that we provide a local provider.
I think we see that there's a lot of trade-offs when you have low-income seniors who are really struggling to make ends meet in so many ways, and then they have to balance, what the cost of food is with the other things going on. And I'll share yesterday, earlier this week, there was a House bill that was introduced, a study on eliminating grocery tax for food. And so it's just a study bill, but it has some bipartisan support. And so I think as we're thinking about what daily life is for low income seniors, anything we can do to help, reduce costs on a lot of fronts, whether it's food or medication or hospitals or hospital insurance. I know, even sometimes when somebody can cook, and it's mentioned in the questions, there are issues with transportation, right? So getting to the grocery store is an issue, or sometimes if people can't stand too long and they need, help with that meal preparation. So it really is, I think, in some ways, and you guys, a holistic issue when you're thinking about somebody's income and how we can provide more income for them so they can purchase healthy foods that they need. And also sometimes that cooking piece, as somebody might be, cooking now for one person or two people and learning how to cook differently so that they can not just be eating junk food or leftovers day in and day out, but making sure that they're trying new foods. That's a cute cat, Linda, so don't worry about it.
He was offended because Amanda never mentioned cats. She just said dogs.
What other things kind of come to mind that are issues facing older adults around nutrition and malnutrition, and where we can spend our time and energy to see some program or policy solutions?
I think in one of the chats that there was, even if everything was aligned and somebody could afford, sometimes transportation was a huge issue. And that's also something that might be available through your local Department of Social Services and your area agency on aging. Will take people to different programs, have different guidelines, and are funded differently, but they can take people to grocery stores, particularly in some areas, and I could say both very urban areas and very rural areas, where even if you get the transportation, you don't know where to go because you're in what we call a food desert area. And I'm sure that probably Amanda and Neil know more about this than I do, but and so getting good food that's not a 7-Eleven, if it's a really high, more of an urban area in the city, you don't get good nutrition there, and there may not be, a really good grocery store that an older adult can navigate or get to or shop that has good nutritious food. And that's a problem for families and older adults. It's a problem and same with really rural areas, the local grocery stores 20 miles out or something like that. So I don't know. Is transportation available? It's going to depend on your county and what your DSS offers or some of your other programs. But I don't know if Neil or Amanda had any comment on those sorts of issues.
The work we've done in Northeastern North Carolina would show that the faith-based communities have stepped up to help with a lot of that.
Yeah, I think one thing is that it's going to show that there's no one-stop shop. We're going to all have to collaborate together to get the problem solved or serve an older adult. There may be 3-4 people in there besides somebody delivering a meal, that help them solve other things. During COVID, we were doing meals to just many of the counties, and a lot of people said, a meal is great, but boy, I'd like produce, or I'd like something fresh. I don't want a frozen meal. I don't want a shelf stable meal or a hot meal that was already cooked. And it'd be nice to just have some produce and fresh vegetable and fruit and even some shelf stable things that I could cook later. Amanda, you had mentioned like beans and rice, and I could cook those on my own. So I know that sometimes gets old,
Amanda, when you talked about some of the work that you've done in Northeastern North Carolina, but can you speak to a little bit about sort of the research and the practice and the bridging of that and some of the other things that you've been learning, and how maybe we can better inform, whether it's the medical community or communities, about some of the things that we know, or where's the research lagging that we need to do more?
Well, I think connectivity is one area that we can continue to need to work on. when a senior accesses care and then trying to, if some malnutrition or food insecurity is identified, what in their community is available real time to assist them. And we've talked about several programs, but I think connectivity is something that we need to continue to work on. NC Care 360's working on that, right? We have several private companies trying to think through creative solutions, apps, and other ways to do that. But I would say connectivity is something that is a real gap in an area we need to continue to work on.
Yeah, I think some of the challenges, even with the apps and the technology, is just, that that literacy and of technology, and getting older adults to be able to use some of that. When, I think about during COVID, when people were ordering food online or getting Grubhub. And so there were just really some barriers there with technology with older adults. And so as we get more broadband access, hopefully throughout North Carolina, that we can continue to think about older adults in the lens of training and technology so that they can better utilize some of these things, even with SNAP benefits, being able to go online and apply for them to get benefit from the ease.
And for the providers, right? I mean, if we see someone airlifted to UNC and we establish that they're food insecure, it's much easier for us to think about a medication in a pharmacy, as everyone knows. But what would the dietitian or the physician in Chapel Hill, how could we access what are the services locally in a county that we don't know about? And I think, in addition to what you're saying, also that is an area that we continue to work on. And a lot of that's word of mouth in the community. I know that in Northeastern North Carolina, a lot of that it's all word of mouth and phone calling. None of that is based on internet. So
great point. Marianne, do you want to, it looks like there's some questions in the chat and I haven't been monitoring them the way I should. Are there?
There are some great questions in the chat. One of our friends, Katie, asked about grandparents raising grandkids and what food and nutrition issues do we see around those seniors. Greg asked if there were viable options for lower income seniors without transportation access and or limited mobility for home delivered meals beyond Meals on Wheels. And Ileana pointed out that Durham recently lost one of the few grocery stores in East Durham that was a major community asset. Ileana, I'm starting to think I could have a whole webinar just hearing you talk at this point too. And Natasha wanted to hear more about working with faith-based communities around food and nutrition programming and services. What's proven successful and what things don't work. I know that was a lot of various questions. So if anyone wants to tackle one.
Come on, anybody want to be brave?
Well, Natasha, I mean, she's a graduate of our program. So is Ileana. So I'm thrilled to see, I can't see both of you, but I can see your name. The pilot work that we've done with faith-based communities has all been based off of connecting with churches that are passionate about getting food to elders in their community. And they've been very creative about that, getting food that's day old bread, for example, and driving that in their cars to people in the community, whether or not they're connected or not to their church or faith community. But no, I mean, nothing has been piloted, past 1 or 2 counties. So.
And I can probably mention some things on caregiver. I know some of the programs that we do help with costs potentially for a grandparent raising a grandchild, such as maybe school supplies, clothes, backpack through the Family Caregiver Support Program. It does not really include food for the child. We can certainly, through the caregiver program or through the congregate or home delivered or some of the supplemental things we're starting to do now with grocery boxes or those sorts of things, provide food to the older adult. But technically it wouldn't help the child, except that I would say start with the school or the Department of Social Services for programs that help with meals for children, school-age children, which again, we saw continue to mobilize and feed children during COVID when there were no schools. There was still the ability, I know in our counties, where parents were able to go by and get lunch and they would pick up 2 meals, lunch and then breakfast the next morning. And those were very active in our counties. So I would think that maybe with some resources and getting hooked in, they could maybe meet both needs. So,
But I do think
And
it
Linda, I just
shows.
want to echo that. I think we all know, right, that families treat food as like the family food, right? We don't think, oh, this is only for little Henrietta, and this is only for grandmother. We don't treat food that way as a family, right? And so, making sure you're tapping into those school resources, the free reduced lunch programs, advocating for universal meal programs wherever they're allowed and available right now at schools will reduce the overall stress of providing food on a family. And certainly schools can go above and beyond that too. There are snack programs, there are supper meal programs, and not many, but some schools do offer those as well. And those are really, really vital resources.
Yeah, I think you just realize how fragmented it is and how it's not very family centered that we have these federally funded programs, but they're totally siloed and it doesn't make sense.
Totally siloed.
Yeah.
And we were at the Community Health Workers Conference back a few months ago, and someone pointed out to us what I think is a real policy failure, and that is that for grandparents raising their grandchildren and for other family members that take in a child that doesn't have a home, there are not financial resources, but for foster families providing a home in an official capacity, there is. And I think we have to think about that. Are we really doing the children justice and doing families justice by making sure some families have the assets and the resources to support children at their most vulnerable moment, but we don't provide their own family with those resources?
And North Carolina does have a high number of grandparents raising grandchildren, but also just kinship care in general, whether it's, outside of the foster care system. So I think that's a huge gap. Great point.
One thing we haven't talked about much this morning is Medicare. And I think this where I spend most of my time is more on the like health lane. And I think that I'm aware of a few increased flexibilities in the last couple years where Medicare, both public Medicare and Medicare Advantage plans have flexibilities to distribute health-related programs dealing with health-related social needs, specifically food, through what's called the special SSBCI, Special Supplemental Benefits for the Chronically Ill. And it's just a way for Medicare plans to be able to, distribute benefits to members who need it. I think it's an underutilized resource. And I'm aware of some plans that have done some things, but it's really on the margins. And one of the Duke Margolis Center came out with a paper kind of talking about this as an opportunity, and some of the reasons why it was not taken more advantage of was that around the complications of managing these types of programs from a healthcare perspective. So that's one of the streams of work that we're really trying to focus on, is how can we get more dollars from the healthcare sector, from these kinds of sources like Medicare, to be able to tap that as a resource. And some of the things that come up in this line of work have really been around thinking about the requirements of working with the healthcare sector. They want to be able to serve their entire catchment area of a given geography, like the state, with a single program. And for all the reasons we've already talked about today, people's technology literacy, or maybe they're very remote, it's a challenge to be able to meet all those requirements with a single program. So I don't know, I'm just kind of raising that as something that I'm aware of, and something to think about.
I think it's a great comment, and with those Medicare Advantage programs, it has given some flexibility, the ability for them to add these complementary benefits beyond their regular Medicare benefits. And you've seen, the emergence of various programs. So I wasn't aware of how much they were utilized or not utilized, but I know it's kind of part of the complementary of benefits that these Advantage plans, as they enter North Carolina, are considering. North Carolina, I'll just add kind of on that same front, North Carolina, with some of the COVID relief dollars that we got, earmarked some for meals for hospital discharge. And so that's a pilot program that's being worked on to roll out to really benefit those who have been hospitalized. And so post-discharge, they would be eligible for X number of meals to ensure adequate nutrition after a hospital stay. But that linkage to the healthcare system, I think, is critically important and critically complicated, since we've got this community-based system that's varies from community to community, and complex providers in both the aging space and kind of the food space as well. And it doesn't always make it easy to navigate for individuals, much less healthcare systems.
And Heather, speaking of complicated, Rachel pointed out that Senior Pharmacist is the Durham Medicare Counseling Site, SHIP maybe, and that every county has a SHIP site with volunteers to help people sort through the complexities of the Medicare plans, which ones have extra benefits like the Medicare Advantage plans, but also which ones provide the overall coverage and medication support that they'll need. And so that's a great resource. And Kate pointed out two things about our tax code, which I don't think gets more complicated. And that's that many working adults are eligible for, but don't claim the earned income tax credit, which is a great point. And grandparents raising children are eligible to claim the child tax credit. And that could mean more than $10,000 for a family with 3 kids. And if they've already filed this year, they can amend it.
I think those are great points to mention. I think, we don't often talk about tax credits, and there are programs in communities to help older adults file taxes every year. So supported by AARP, and I was glad to hear the mention of the SHIP program, because those are usually located in community organizations and maybe a senior center or a coalition or a council on aging. And not only are they talking about those Medicare Advantage programs, they also can help people get signed up for low income or extra help to help pay for those Medicare premiums as well, and prescriptions. So, there are other benefits as well through Medicare that might be able to help with the overall income and savings of dollars that might allow for more food, money for food. Sorry, I stumbled through all that. Any other comments that you guys have about those? Somebody earlier on, and I've got to scroll back, talked about food pantries and where do they fit in terms of communities and all of this array of services, and how maybe are there special outreach for older adults around food pantries, or innovations where food pantries are maybe being developed within senior centers or other kinds of outreach?
So yeah, I'm just aware of a few of things you just mentioned. Senior centers hosting pantries, and I think from what I guess, and from my perspective, the pantries are super effective at creating connectivity and a place for people to connect, and either just for social connection needs, or perhaps even like organizing and kind of lifting voices. As we all know, people start and run pantries from usually on a volunteer basis. So that's, I think, a it's critically important to serve as an emergency backstop. But I think from a systemic trying to reach a lot of people and move the needle in a big impact way, I think pantries are best suited as a community-based solution. And then how can we think beyond that so that we can kind of work upstream and prevent people from needing that emergency food assistance in the first place.
Yeah, I think Neil's right. That's where some of the different nonprofits and community-based organizations and faith-based communities really shine, is when they put together these pantries and get things out to, maybe not specifically older adults, but they benefit as well. But I'd like to say for the first time as well that over the last 3 years, the area agencies on aging and the providers that we've funded have been able to do, again, grocery boxes and produce boxes and groceries where that's never ever been allowed. So the food banks and so forth have been partners where they never have before, and we've been able to pay for those things or have those things gotten together or had grocery deliveries and cares and ARPA. Don't ask me now to remember what that stands for, but they were both COVID relief funds through all federal funding, have been helpful in that, and we're hoping will affect lasting change, that it's not just a one and done.
I think that's the creativity and innovation and flexibilities that came with those COVID dollars, I think have been, really insightful to see what the needs of older adults were and to be able to fund some things in a new way. And I would imagine those food banks, when started thinking about older adults, maybe needed to rethink some of what was in those donations, like size wise and other things. So I think there was a lot of learning in that. So we are getting close to our 1 hour, and I don't want to overlook anything. I think we've had a really rich conversation touching on a lot of topics, and enough to make your head spin on a Friday. But what I'd like to do is just go through each of you and give you the opportunity to remark about any reflections on this discussion, but also, what other things do you want to make sure get mentioned in this space, and what needs to get done, or where can we do better as a state? And I'll start with you, Linda, because you're bigger on my screen. So I don't know why, but you are. Yeah.
I liked where Neil was going in thinking about nutrition. That everybody says, right, nutrition is medicine, and if we can get some of that developed and get some partnerships and get, you could do all kinds of things if you come home from the hospital and had hip surgery or more serious surgery, but if you don't eat well, you're not going to have what you need to do to heal or to do anything. So I think that he was onto something, that we need to get more involved in this space, have them take it more seriously, and then have them be able to purchase, get this integrated through local providers, through the networks that already exist, and get those meals purchased and sent to these people, because there's a wonderful foundation that exists of providers. And we always say, don't rebuild something that already exists that'll cost you twice as much. Use what's out there. So we like that. And the other thing that we've learned a lot, which everybody knows, this isn't earth-shattering, is that food is social. That's also something. So probably had increased problems because nobody wants to eat alone. Everybody wants to eat with family. During the past 3 years, that's been a challenge. As I said before, we don't even have all of our congregate dining sites open. So those are really important things, and I think we need to look at those ways to continue to advocate, all of us, for more creative solutions to reaching everybody. It's not a one-stop, everybody must go to a congregate site, or everybody has to get, I have some counties that they deliver all frozen meals for home delivered meals. Well, I don't know how appetizing that is. I think it's a great solution, but I don't know that it's always the best thing because some people like that hot meal. So I just think that looking at different things, being advocate for to your state and federal legislators about how can we solve these problems and how can we keep some of these flexibilities and creative ways and be more person-centered to meet the nutrition needs of each older adult and somebody said before that includes their families sometimes. So
Love it. Well
I
said.
just I just piggyback off of that and continue to echo that I think we need to incentivize discharge planning and then think about improvements in discharge planning as it relates to nutrition and providing meals. And Ileana put an example in the chat of what is going on in New Hanover County at the hospital there. But I think while the hospitals are incentivized to screen for malnutrition and treat that and can get reimbursed for that on the inpatient side, and they may screen for food insecurity, there needs to be another step that's more ubiquitous in discharge planning, in my opinion. And I think another thing to think about is continuing to think about state policy on cross-program enrollment and where is their opportunity there.
Awesome. Neil?
And
Jump in.
I'll piggyback on that last comment about cross-program enrollment. I think one of the major reasons we've talked about for seniors not being on SNAP is this piece around outreach. And I think that piece about cross-program enrollment is a good one. There are lots of proxy data points, right? Data sets that already exist that we could use as ways to provide to do affirmative outreach to people who we know are eligible, or they may be close enough to being eligible that they could give us a leg up instead of having to pass out flyers in front of every grocery store. So there's some shortcuts, I think, that using these cross-program data set concept. Something else I think for me, and it's something that kind of keeps me going in this work, is to look where the money is. Why do bank robbers rob banks? Because that's where the money is. How are we going to get food to people? Well, let's look where the money is. And I think, SNAP is a big one. I think there's a fight coming around SNAP. So I see Jan Jones is on the call. I know she's really involved. Shout out to her. I think folks who want to do advocacy around improving or increasing or maintaining SNAP, there's a lot of opportunities there and are gonna be coming. And then the other is just with another big money opportunity is in North Carolina, the Healthy Opportunities pilots. I know it's Medicaid, so it's a little bit different, but and it's not in all regions, so not everyone can participate. But for those who are in those regions, and I think I see some folks on this call who are participating, I think that's a really important area to lean into, because that could be an important it taps us into a whole new realm of possibility, doing this kind of discharge planning, going beyond just screening for food insecurity, but actually doing something about it. The HOPS in North Carolina is a really unique opportunity to be a part of that.
Well, thank you all. And I appreciate all of the comments. And I think you've spurred a lot of other conversations we could have around this. I think the opportunities are really, endless in terms of improving coordination, access to funding and collaborative thinking. And so, and there's the good news, I feel like, out of the themes is that there's a lot of work that's been started, and maybe we're not doing it across the board, or it's not adequate funding. But I do think it's promising, all of the activities that we have in North Carolina, and we just need to keep advocating to bolster it and to amplify this work and work hard to make sure that we are making those connections. So I appreciate everybody's time today and the attendance when you could be doing so many things that you would want to focus on seniors and nutrition and malnutrition. It's an important topic and crosses so many different sectors. And so just with the questions that we've had, I know we've had a lot of expertise just on the call. And so hopefully everybody was able to take away a few things today, and also feel empowered to continue your work in your communities in the state to improve the situation for older adults in this space. Mary Ann, do you have anything that you want to add to the wrap up?
No, y'all have given me so much food for thought. Pun intended.
Yeah,
And I
that's
just
cute.
wanted to thank Heather and the North Carolina Coalition on Aging for being such a critical voice and partner on this work. This is a really complicated issue. And every time I hear people speak about it, it sounds more complicated and more challenging. But there's so many good things happening also, and that's promising. So thank you, Heather. Thank you, Linda, Amanda, and Neil. We're so grateful to you.